You have probably noticed that some days are dramatically worse than others. The tremor is heavier, the stiffness sets in earlier. Getting from one room to the next takes more out of you than it should. And you may have assumed this is simply the disease, unpredictable, random, something to endure and wait out. Some of that variation is the disease, but here's what most people with Parkinson's are never clearly told, and what research from Harvard Medical School, the Mayo Clinic, and the Parkinson's Foundation has been building a compelling case around for years. A significant portion of that day-to-day fluctuation is not random at all. It is not the disease acting on its own. It is the disease being amplified, measurably, consistently, by specific things people do every single day without realizing the neurological consequence. Not dietary choices, not supplement questions, not medication decisions. Ordinary behavioral habits, the kind that feel completely neutral, the kind that in some cases feel like the right and sensible thing to do. And that's exactly what makes them so damaging, because no one stops to question them. Today, we're going to go through 7 of those habits, counting down from number 7 to number 1. For each one, I'm going to explain precisely why they worsen tremors, stiffness, and progression on the neurological level. And I'm going to give you a specific action you can take differently starting today. Not vague advice, something concrete. I need you to stay with me until number 3, because number 3 involves something the vast majority of Parkinson's patients do every single morning, something that genuinely feels helpful and even physically soothing, that research indicates may be directly responsible for why your worst hours of the day happen exactly when they do. That one tends to stop people. Let's get into it. Here is something that almost never comes up in the typical post-diagnosis appointment. Prolonged, unbroken sitting may be one of the most quietly destructive daily habits for someone living with Parkinson's disease. Not sitting occasionally, not resting after physical effort. We are talking about long, passive stretches of staying seated, 2 hours in front of the television, 3 hours in a recliner, with no movement breaks at all in between. The Parkinson's Foundation has specifically identified sedentary behavior as a significant risk factor for accelerated motor decline in Parkinson's patients. And when you understand the neuroscience behind it, you see exactly why. Parkinson's disease disrupts the brain's dopaminergic system, the network responsible for producing and circulating dopamine, the chemical messenger that enables smooth, coordinated movement. Physical activity, even gentle, low-intensity movement, like a slow walk through the house, stimulates blood flow to the basal ganglia and the motor cortex. These are the brain regions most directly damaged by Parkinson's disease. That blood flow helps the remaining healthy neurons work more efficiently and supports the brain's ability to produce and use dopamine. When you sit still for hours at a time, that crucial blood flow drops, your muscles begin to stiffen, the motor neurons responsible for coordination become increasingly inactive, and over time, this sustained physical inactivity feeds directly into the very symptoms Parkinson's is already driving you toward: rigidity, slowness of movement, reduced motor flexibility, and difficulty initiating motion. Research published through the American Academy of Neurology found that Parkinson's patients who maintained extended periods of daily inactivity showed significantly faster progression of motor symptoms compared to those who incorporated regular movement breaks throughout the day. The corrective action here is straightforward. Set a timer for 45 minutes every time you sit down. When it goes off, get up, walk to another room and back. March slowly in place for 60 seconds. Roll your shoulders 5 times. That is all it takes. Research from Harvard Medical School confirms that movement breaks as short as 2 to 5 minutes are sufficient to re-engage motor pathways in the brain, improve blood flow to movement-related brain regions, and measurably reduce the rate of stiffness-related decline. This is not about pushing through pain. It is about not allowing your brain's motor system to go dormant for extended periods. A sticky note on your television remote, a simple alarm on your phone, whatever it takes to make this automatic and non-negotiable. Start today. Let me ask you something, and I want you to answer honestly. How often do you try to walk and carry something at the same time? Walk while having a conversation. Walk while mentally running through your schedule or trying to remember something important. If you answered often, you need to hear what comes next. Rushing and trying to do multiple things at once during movement is one of the most reliable and well-documented triggers of freezing of gait in Parkinson's patients. Freezing of gait is that sudden, terrifying sensation where your feet feel locked to the floor. Your brain is sending the signal to move, but your body simply does not respond. It can happen without warning, and it dramatically increases the risk of a serious fall. Here is the neurological explanation. In a healthy brain, walking is largely automatic. The motor system runs it on autopilot without requiring significant mental attention, which is why healthy people can walk, talk, and think simultaneously without any difficulty. In Parkinson's disease, that automaticity is progressively degraded. Walking becomes a task that requires deliberate, conscious mental focus to execute safely. The motor system can no longer operate reliably on its own. So when you rush, when you try to walk quickly while simultaneously carrying something, responding to a question, or managing multiple thoughts, you are splitting the cognitive resources your impaired motor system critically needs. The result is system overload, and a freezing episode is often the outcome. The Mayo Clinic specifically identifies divided attention during movement as a key trigger of freezing of gait and one of the leading contributors to fall risk in Parkinson's patients. Falls for someone over 60 with Parkinson's are not minor events. They carry real and serious consequences: fractures, head injury, hospitalization, and sometimes a sharp and permanent decline in independence. The behavioral correction requires a genuine mindset shift, but the practice itself is simple. When you are moving, only move, one task at a time, every time. Before you stand, pause, think about standing, then stand. Before you turn, plant your feet, think about the direction, then turn deliberately. If someone speaks to you while you are mid-movement, it is completely appropriate and smart to stop, respond, then continue. Slow and deliberate is not weakness. It is exactly the right strategy for a nervous system managing Parkinson's. I want to hear from you on this one. Drop a comment below. Have you ever noticed your freezing episodes happen more when you are distracted or in a hurry? Because I think you'll find this pattern comes up far more often than you previously realized. Most people understand that dehydration is bad for general health, but what is far less understood, and especially important for anyone with Parkinson's disease, is that even mild dehydration has a direct, measurable impact on neurological function. The brain is approximately 75% water by composition. The neurons responsible for dopamine signaling and motor coordination require a precise fluid balance to fire accurately and efficiently. When the body drops even 1 to 2% below its optimal hydration level, what researchers call mild dehydration, mind processing slows, motor coordination worsens, and muscle function degrades. In a healthy person, this causes fatigue or a mild headache. In someone with Parkinson's, the consequences are significantly more serious. Mild dehydration in a Parkinson's patient amplifies tremors, worsens the slowness of movement already caused by the disease, intensifies mental fog, increases constipation, and critically, it is one of the most common triggers of orthostatic hypotension. That is the sudden, sometimes severe drop in blood pressure that occurs when you stand up, producing dizziness, lightheadedness, and dramatically increased fall risk. The Parkinson's Foundation specifically identifies adequate daily hydration as a core component of both fall prevention and ongoing symptom management. Here's what makes chronic dehydration so easy to overlook. As we age beyond 60, the body's thirst signals naturally become less sensitive and less reliable. You can be meaningfully dehydrated and not feel particularly thirsty. What you might feel instead is unusual fatigue, more pronounced confusion, or a worsening of motor symptoms that particular day, without ever connecting it to how little fluid you have consumed. The corrective action: target 6 to 8 glasses of plain water per day, roughly 48 to 64 ounces. Do not rely on thirst to prompt you. Instead, anchor your hydration to habits you already perform automatically. Have a glass of water every time you take your medication. Have one before each meal and one after. Keep a water vessel visible and within reach at all times, on your desk, beside your chair, on the kitchen counter, not stored away where you have to remember to go get it. One important point: caffeinated drinks and alcohol are diuretics. They draw fluid from your body. They do not count toward your hydration total. Plain water is what your brain and nervous system actually need to function. Now we arrive at something many people feel uncomfortable discussing openly. But I need you to stay with me here, because what I'm about to share is one of the most important and most underappreciated scientific findings in all of Parkinson's research over the past decade. Constipation in Parkinson's is not just an uncomfortable side effect. It is not merely a quality of life inconvenience you should learn to tolerate. Current research from Harvard Medical School, the Parkinson's Foundation, and the American Academy of Neurology indicates that constipation is a fundamental part of the disease process itself, with direct implications for how rapidly Parkinson's progresses. Here is the science behind it. The gut contains its own independent nervous system called the enteric nervous system, with more neurons than the entire spinal cord. The brain and the gut are in constant, direct two-way communication through this system, primarily via the vagus nerve. Scientists refer to this connection as the gut-brain axis. What has profoundly affected Parkinson's research in recent years is the discovery that the misfolded proteins called alpha-synuclein, the molecular hallmark of Parkinson's disease in the brain, have been found in the enteric nervous system years, sometimes a decade or more, before any motor symptoms ever appear. This has led many neurologists to theorize that for a significant number of patients, the disease process may actually begin in the gut before making its way toward the brain. When your bowels are sluggish, when stool remains in the colon for extended periods, the inflammatory environment that creates, combined with the ongoing presence of those abnormal proteins, may allow this process to continue. And through the vagus nerve, these effects can propagate upward. Now, I want you to answer this honestly right now. How many days out of 7 are you having a regular, comfortable, complete bowel movement? If the answer is fewer than 5, this needs to become an active, discussed priority in your medical care, not something you quietly accept. The practical steps for improvement: physical movement after meals, even a slow, gentle 5-minute walk, is one of the most effective natural stimulants for bowel motility. Gentle clockwise abdominal massage can also support this. Establishing a consistent daily bathroom routine, even if you do not feel an immediate urge, gradually trains the body toward regularity. And please, speak openly with your neurologist or primary care physician about this. There are safe, evidence-based approaches for managing constipation in Parkinson's patients, and you should be actively using them. Do not accept this as just another unavoidable feature of the disease. I told you number 3 would stop you. Here it is. For most of your life, a hot shower has been a morning comfort, a ritual, a genuine source of relief, especially when your body feels stiff and your muscles ache, as they so often do with Parkinson's disease. A long, hot shower probably feels like one of the few things that actually makes your body feel better each morning. If you have Parkinson's disease, that hot shower may be actively and measurably worsening your symptoms. And the reason involves a complication of Parkinson's that most patients are never clearly explained. It is called autonomic dysfunction. The autonomic nervous system controls the functions your body manages without conscious effort: your heart rate, your digestion, your temperature regulation, and critically, your blood pressure control. In Parkinson's disease, this autonomic system becomes progressively impaired, and one of the most common and dangerous consequences is a condition called orthostatic hypotension, a significant sudden drop in blood pressure triggered by changes in body position or by exposure to heat. Here is what physically happens during a hot shower. The heat causes blood vessels throughout your entire body to dilate, to widen dramatically, as your body attempts to move warmth away from the core and toward the skin surface. In a healthy cardiovascular system, this is compensated for rapidly. The heart rate adjusts, blood pressure remains stable, and everything feels fine. In a Parkinson's patient with autonomic dysfunction, that compensatory response is slow, weakened, or entirely absent. Blood pressure drops, blood flow to the brain decreases, and within minutes of standing under that hot water, you may feel dizzy, disoriented, unusually weak, or dangerously unsteady on your feet. Studies cited in Mayo Clinic neurology resources indicate that orthostatic hypotension affects between 30 and 50% of people with Parkinson's disease. Many of those people have absolutely no idea they have this condition. They attribute their morning dizziness, their shakiness after showering, their difficulty functioning in the first hour of the day to Parkinson's in general. The hot shower never enters their mind as a contributing factor. But here's the second layer, and this is the one that surprises people most. Beyond the blood pressure issue, prolonged exposure to hot water causes a temporary, widespread suppression of nervous system activity. For someone without Parkinson's, this neurological suppression produces a pleasant, soothing relaxation. For someone whose motor system is already impaired, this neurological suppression can intensify tremors, deepen rigidity and stiffness, increase fatigue, and make the first 2 to 3 hours of your morning significantly harder than they otherwise need to be. Think about that for a moment. Something you have been intentionally doing because it seems to help, because it feels soothing in the short term, may be one of the reasons your mornings are so difficult. The fix is genuinely simple, though it requires a real commitment to change. Switch to lukewarm showers. Not cold, not uncomfortable, but comfortably warm, not hot. This substantially reduces the vasodilation effect and the resulting blood pressure drop. A shower bench or shower chair is an excellent investment if you do not already have one, as it eliminates the compounded safety risk of standing for prolonged periods while your blood pressure is unstable. A secure grab bar within easy reach is non-negotiable. I genuinely want to hear from people watching this. Has anyone already made this switch to cooler showers, intentionally or by recommendation? Leave a comment below and tell me whether you noticed any difference in how you felt during your morning routine. Because for many people, this single change produces a real and noticeable improvement within just a few days. Take a moment right now and check your own posture as you watch this video. Is your head pushed slightly forward ahead of your shoulders? Are your shoulders rolled inward toward your chest? Is your upper back rounded? Is the space inside your ribcage compressed, narrowing the room your lungs have to fully expand? Now here is what I need you to understand about that posture, because most people assume it is simply what Parkinson's looks like. They assume the forward-leaning head, the caved chest, and the hunched upper back are inevitable, irreversible consequences of the disease, something to accept and manage around. That assumption is costing people far more than they realize. Because here is what the research shows. The habit of maintaining poor posture and breathing shallowly does not just result from Parkinson's disease, it actively accelerates the disease's impact on your brain, your motor system, and your overall neurological health. Here's how. When your chest is habitually collapsed and your shoulders are chronically rounded forward, your lungs cannot fully expand. With every breath you take in that position, you are receiving a fraction of the oxygen your lungs are actually capable of delivering. Shallow breathing means your blood and your brain are operating with less oxygen than they need to function optimally. And your brain, already under the metabolic stress of Parkinson's disease, with its impaired dopamine pathways, its damaged motor circuits, and its increased demand on remaining healthy neurons, is the last organ that should be running on a reduced oxygen supply. Research from Harvard Medical School on the relationship between posture, breathing, and neurological function confirms that chronic postural compression impairs neurotransmitter synthesis, including the production of dopamine itself, and directly worsens both cognitive performance and motor control over time. But the cascade of consequences from poor posture goes even further. Slouching compresses the nerves of the thoracic spine, contributing to increased pain and sensory disturbance. It impairs the efficiency of the digestive system, which worsens the constipation problem we already discussed. It reduces vocal volume and projection, which is already a significant challenge for many Parkinson's patients. It increases muscular rigidity in the chest, neck, and shoulders. And perhaps most important for daily safety, it shifts your center of gravity forward, substantially increasing your risk of falling in the forward direction, one of the most common and dangerous fall patterns for people with Parkinson's disease. Clinical guidance from the Parkinson's Foundation and research supported by Harvard and other leading institutions consistently support posture correction and diaphragmatic breathing as among the highest impact non-pharmacological interventions available to Parkinson's patients. Here's how to begin correcting this, starting right now. Take a slow, full breath in through your nose. Let your chest rise. Gently draw your shoulders back and downward, away from your ears. Lengthen the back of your neck, as if someone is lightly lifting the very top of your head toward the ceiling. Now breathe again from that position. Notice how much different it feels, how much more air you are taking in, how much more open your chest is. That is how your body should feel for as much of the day as possible. Practical strategies for maintaining this. Set a phone reminder every 2 hours labeled simply posture. Use a firm chair with proper lumbar support rather than deep, soft furniture that allows and encourages you to collapse. If you're working with a physical therapist, and if you're not, I strongly recommend finding one who specializes in neurological conditions. Ask them specifically about exercises for thoracic spine mobility and core stabilization. The results of targeted postural work can be remarkable, and they often come faster than most people expect. Build a daily practice of diaphragmatic breathing, what is often called belly breathing, into both your morning and your evening, 5 minutes each time. Breathe slowly in through the nose, allow your belly to expand outward, and exhale slowly and completely through the mouth. This is not simply a relaxation technique. This is active neurological support. Your brain needs that oxygen. Your posture determines how much of it you are actually delivering. We have reached number 1, and I want to be as direct with you as I can right now, because this is the most important information on this entire list. Irregular medication timing, taking your doses late, occasionally skipping them, or treating the schedule as flexible, is quietly one of the most damaging habits a person with Parkinson's disease can fall into, and it is far more common than most people realize. Not because people are careless, but because the severity of what happens when the timing is inconsistent is almost never explained with enough clarity. So let me explain it clearly. The primary medications used in managing Parkinson's disease work by restoring or mimicking the dopamine signal in the brain's motor circuits. These medications have what pharmacologists call a narrow therapeutic window, meaning they only produce their intended effect within a specific, relatively tight concentration range in your bloodstream. Below that range, your brain lacks sufficient dopamine support to coordinate movement effectively. Above it, you risk developing involuntary, uncontrolled movements known as dyskinesias. The functional margin between these two problematic states can be as narrow as 30 to 45 minutes of timing variation. When you take a dose late, even just 30 to 45 minutes late on a consistent basis, your concentration in your blood drops below that therapeutic threshold. In that window, your symptoms do not merely return to where they were before your last dose, they surge. Tremors become dramatically more pronounced. Muscle rigidity intensifies and can become severe. The risk of a freezing episode spikes sharply. Your ability to walk safely, to speak clearly, to swallow normally, all of this can deteriorate rapidly in ways that go well beyond what you experience during typical medicated periods. But here is what is rarely communicated clearly enough, even with well-meaning doctors and caregivers. These repeated dips below the therapeutic threshold, these repeated periods when your medication is insufficient, do not merely cause temporary worsening that fully resolves with the next dose. Over months and years, consistent subtherapeutic periods are associated with functional deterioration that goes beyond what the natural disease progression alone would produce. The brain's responsiveness to medication, its sensitivity, can be reduced over time by chronic, inconsistent dosing. The periods when your medication is working well tend to become shorter. The difficult periods when the medication has worn off tend to become longer, more severe, and increasingly hard to manage. The American Academy of Neurology's published clinical guidelines for Parkinson's disease management state explicitly that consistent, on-schedule medication administration is among the most critical determinants of long-term functional outcome in Parkinson's patients. Not approximately on schedule, not whenever you happen to remember. On schedule, precisely, predictably, every single day. Here is exactly what you need to do starting today. First, know your complete dosing schedule. Every medication, every dose, every exact time. Write it down on paper. Post it on the refrigerator. Post it above the bathroom sink, somewhere unavoidable, somewhere you see it every single morning without exception. Second, set a dedicated alarm in your phone for every single dose. Not a general reminder, a specific alarm for each dose that treats that moment like a medical appointment you simply cannot miss or delay. If you do not have a smartphone, simple and inexpensive pill alarm devices are widely available at any pharmacy and serve the same purpose effectively. Third, if you miss a dose, do not attempt to compensate by taking a larger amount later. This creates the kind of blood level instability that causes more problems than handling a missed dose correctly and cautiously. Fourth, ask your neurologist specifically what to do if you genuinely miss a dose. Have a clear, pre-planned response in writing before you ever need it. Fifth, if travel, a medical procedure, or any significant change in your routine might interfere with your normal dosing schedule, discuss this with your medical team in advance. Do not improvise in the moment. If you do only one thing after watching this video today, just one thing, make it this. Open your phone right now, or pick up a pen and a piece of paper and write out your complete medication timing schedule. Set every alarm. Make the system foolproof. Because this habit, getting your medication timing precise and absolutely consistent day after day, may be the single most powerful action available to you to protect your long-term quality of life with Parkinson's disease. Everything else we talked about today matters, but nothing matters more than this. Parkinson's is a serious diagnosis, and I will not minimize that. But the evidence from the Parkinson's Foundation, from Harvard Medical School, from the Mayo Clinic, and from the American Academy of Neurology is consistent and compelling. The speed at which your symptoms progress is not entirely outside your control. These 7 daily habits, behaviors that look ordinary and harmless on the surface, have real, measurable consequences for the trajectory of this disease. You cannot reverse Parkinson's through lifestyle choices alone, but you absolutely can slow its progression, protect your independence, and hold on to a higher quality of daily life for significantly longer through consistent, informed decisions made every single day. If any one of these 7 habits resonated with you today, if you recognized yourself in 2 or 3 or 4 of them, please drop a comment below right now. Tell me which number surprised you the most. Tell me which habit you are committing to change first. Your experience in those comments helps every other person with Parkinson's watching this and looking for a place to begin. You are not navigating this alone. In the next video, we are going deeper on one of the most underestimated factors in Parkinson's management, the specific ways your sleep quality and sleep patterns are directly affecting your motor symptoms, your cognitive function, and your disease progression, and what you can do about it that goes well beyond simply going to bed a little earlier. That video is coming up next. Stay with us.